This is Tim Jorgensen in Product Development with Intercorp Limited. Sometimes we get the question, are Fatal Vision goggle products evidence-based? The simple answer is yes. The Fatal Vision alcohol impairment simulation goggle is evidence-based. There's been at least 4 studies and 1 white paper looking at the effects of the Fatal Vision goggles. The information for these studies is shown below this video. All Fatal Vision goggles use a process of eliciting behaviors specific to an impairment, whether alcohol, marijuana, distraction, or opioid, paired with customized activities to provide experiences emphasizing the impairment's severity and individual susceptibility to that impairment. But what does it mean to be evidence-based? An evidence-based practice has been rigorously evaluated in experiential evaluations, like randomized controlled trials, and shown to make a positive, statistically significant difference in essential outcomes. However, it is important to know evidence-based practices are not infallible. However great evidence-based practices may sound, in many circumstances, the techniques aren't infallible. As with any scientific research, it is susceptible to human error. Evidence isn't always perfect, and experiments aren't always observed as they should be. Sometimes research is incomplete or contradictory. Also, it is important to know that there isn't any cookie-cutter approach to delivering a Fatal Vision presentation. Research doesn't show that one type of presentation works completely while another doesn't work at all. Instead, there are varying levels of proven research, dividing evidence into weaker and stronger categories of effectiveness. Ultimately, the goal of our programs is to facilitate behavior change. However, it is problematic to expect that a brief delivery of any program will result in behavior change. Changing behavior is tough and unpredictable. Typical Fatal Vision demonstrations are done in group settings for brief periods. It would be unreasonable to expect positive behavior change after one Fatal Vision demonstration. One of the important outcomes of using Fatal Vision tools is the interest generated in the topic of impairment. Fatal Vision helps in getting participants' attention and can foster a discussion that may eventually lead to positive behavior change. The first step in persuasive communication is to get a person's attention, which Fatal Vision does very well. This allows the presenter to continue the discussion with thought-provoking questions and insights. In summary, Fatal Vision is an experiential, persuasive communication tool used to provide health and safety advocates a means for fostering a conversation about a safety issue and hopefully persuade participants to consider positive alternative behaviors.